They said Corporal Sarah Chen was too gentle for combat medicine, too emotional to make the hard decisions when Marines were bleeding out in the sand. By sunrise, she would prove them wrong by pulling 47 wounded warriors from the jaws of death, while enemy bullets carved deadly patterns through the air around her. The doubters would never again question whether a soft heart could house the fierce determination needed to defy death itself. The desert wind carried the acrid smell of burned diesel and cordite across Forward Operating Base Thunderbolt, a collection of concrete barriers and prefabricated structures that served as humanity's precarious foothold in the unforgiving landscape. Haute-Thelman Province. Sarah Chen knelt beside her medical kit in the base's aid station, methodically checking each piece of equipment with the same careful attention she had applied to every task since arriving in Afghanistan 3 months earlier. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. Her movements were precise and economical, each action serving a specific purpose in maintaining the medical supplies that could mean the difference between life and death when the inevitable call for help arrived. The aid station occupied a reinforced concrete bunker that had been constructed to withstand indirect fire while providing adequate space for treating multiple casualties during mass casualty events. Medical equipment lined the walls in carefully organized arrays, each item positioned for immediate access during emergency situations when seconds could determine whether wounded Marines survived long enough to reach surgical facilities at the main base. Sarah had spent countless hours familiarizing herself with every piece of equipment, practicing procedures until muscle memory replaced conscious thought, preparing for the moment when her training would be tested under the worst possible circumstances. Staff Sergeant Michael Torres, the senior medic responsible for training and evaluating junior personnel, observed Sarah's equipment checks with the critical eye of someone who had seen too many young medics crumble under the pressure of actual combat casualties. His weathered face reflected 12 years of military medical service, including multiple deployments to Iraq and Afghanistan, where he had witnessed the full spectrum of human courage and failure under extreme stress. Torres had developed strong opinions about the type of personality required for effective combat medicine, beliefs shaped by brutal experience with medics who possessed excellent technical skills but lacked the emotional resilience necessary for sustained operations in hostile environments. Sarah's performance during training exercises had been technically flawless, her medical knowledge comprehensive, and her procedural execution precise beyond criticism. However, Torres remained skeptical about her ability to function effectively. When faced with the psychological trauma of treating severely wounded Marines while under enemy fire, he had observed her emotional reactions during particularly realistic training scenarios, noting tears in her eyes when treating simulated casualties, and hesitation when forced to make triage decisions that prioritize some patients over others. These observations led Torres to conclude that Sarah possessed the compassion necessary for peacetime medical care, but lacked the emotional detachment required for battlefield medicine. The conversation that would define Sarah's reputation among the base's medical personnel occurred during a routine evening briefing 3 weeks after her arrival at Forward Operating Base Thunderbolt. Torres addressed the assembled medical staff with his characteristic bluntness, discussing the psychological challenges that combat medics faced when treating wounded comrades under hostile conditions. His comments about the need for emotional control and clinical detachment were clearly directed toward Sarah, though he maintained the pretense of general instruction rather than personal criticism. Torres explained that effective combat medics required the ability to compartmentalize emotional responses while focusing entirely on medical procedures that could save lives. Medics who became emotionally invested in individual patients often made poor triage decisions, wasting critical time on casualties who could not be saved while neglecting patients who might survive with immediate treatment. The harsh reality of battlefield medicine demanded practitioners who could view wounded Marines as medical problems to be solved rather than human beings suffering unimaginable pain and trauma. Torres suggested that medics who displayed excessive emotional sensitivity during training would likely prove ineffective when faced with actual combat casualties, particularly during sustained firefights when treatment had to be provided while under direct enemy observation and fire. Hospital Corpsman First Class Jennifer Walsh, who had served 2 previous deployments in combat zones, supported Torres's assessment with her own observations about the psychological demands of battlefield medicine. Walsh described scenarios she had encountered where emotionally compromised medics had frozen during critical moments, unable to function when confronted with the reality of treating friends and colleagues who had suffered catastrophic injuries. She emphasized that combat medicine required practitioners who could maintain clinical objectivity while working in environments where failure meant watching people die who might otherwise have survived with competent medical intervention. Petty Officer Second Class David Kim, the youngest member of the medical team aside from Sarah herself, expressed private doubts about her emotional stability based on her reactions during training exercises that simulated mass casualty scenarios. Kim had observed Sarah's difficulty maintaining composure when forced to prioritize patients during triage exercises, particularly when scenarios required her to classify certain casualties as expectant, meaning that their injuries were so severe that medical resources would be better utilized treating patients with higher survival probabilities. Kim believed that Sarah's tendency to become emotionally attached to patients would prevent her from making the brutal calculations necessary for effective triage during actual combat operations. The medical team's collective assessment of Sarah's capabilities reflected broader cultural assumptions about the relationship between emotional sensitivity and professional competence in high-stress environments. The consensus among her colleagues was that Sarah's compassionate nature, while admirable in civilian contexts, represented a liability in combat situations where medical personnel needed to function with machine-like efficiency regardless of the human cost of their decisions. They viewed her tears during training exercises as evidence of emotional weakness rather than recognition of her deep commitment to preserving human life under any circumstances. Sarah understood the criticism directed toward her, though she disagreed fundamentally with the assumption that emotional sensitivity and professional competence were mutually exclusive. Her approach to combat medicine was informed by her belief that maintaining emotional connection with patients actually enhanced her ability to provide effective medical care by motivating her to explore every possible treatment option and fight for every life regardless of the odds. Sarah had observed that medics who completely detached themselves emotionally often became complacent, going through procedural motions without the passionate commitment necessary to achieve results that exceeded textbook expectations. Her medical training had emphasized the importance of treating the whole person rather than simply addressing specific injuries, an approach that required understanding the psychological and emotional dimensions of trauma in addition to its physical manifestations. Sarah believed that her ability to connect emotionally with wounded Marines provided her with insights into their condition that purely clinical assessment might miss, allowing her to tailor treatment approaches based on individual patient needs rather than standardized protocols. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. She had consistently achieved superior results during training exercises, precisely because her emotional investment motivated her to work harder and think more creatively about treatment options than medics who maintain purely professional relationships with their patients. The philosophical differences between Sarah and her colleagues reflected broader debates within military medicine about the optimal balance between clinical objectivity and empathetic patient care. Sarah represented a newer generation of medical practitioners who had been trained to view emotional intelligence as a critical component of effective medical treatment. while her more experienced colleagues had been shaped by traditional military culture that emphasized emotional suppression as a necessary survival mechanism in combat environments. These conflicting approaches would be tested when Forward Operating Base Thunderbolt faced its first major combat operation since Sarah's arrival. The mission briefing that would determine Sarah's reputation took place in the base's Tactical Operations Center, a windowless room filled with communication equipment and digital displays, showing real-time intelligence about enemy positions and coalition force movements throughout the region. Major Patricia Anderson, the base commander, presided over the briefing with the professional demeanor of an officer who had commanded combat operations in multiple theaters while maintaining responsibility for the lives of 800 Marines under her authority. Anderson's presentation style reflected 15 years of military leadership experience, her voice carrying no emotion as she outlined operational parameters that would determine whether Sarah and her colleagues lived or during the next 48 hours. The mission involved establishing a forward patrol base in the Sangin Valley, a region that had seen intense fighting during previous coalition operations and remained contested territory where Taliban forces maintained significant influence over local populations. Intelligence indicated that insurgent forces were using the valley as a staging area for attacks against coalition supply convoys and had established weapons caches and training facilities that posed strategic threats to coalition operations. Throughout Helmand Province, the planned operation would insert a reinforced Marine company into the valley with the mission of disrupting insurgent activities while establishing a permanent coalition presence that could support future operations in the region. Medical support for the operation would be provided by a 4-person team consisting of Torres, Walsh, Kim, and Sarah, each assigned to different elements of the Marine Force to ensure that medical care could be provided regardless of how the unit became dispersed during combat operations. Sarah would be assigned to the lead platoon, which had the mission of securing the initial landing zone and establishing defensive positions that would protect the remainder of the force during the insertion phase. Her assignment to the most dangerous element of the operation reflected standard procedures for distributing medical personnel rather than any assessment of her capabilities or experience level. Torres reviewed medical evacuation procedures and triage protocols that would govern treatment decisions during the operation, emphasizing the importance of maintaining clinical objectivity when multiple casualties required simultaneous treatment. His briefing focused heavily on resource management and patient prioritization, reflecting his belief that combat medics needed to think like military logisticians rather than hospital emergency room physicians. Torres stressed that medical personnel could not allow emotional attachments to individual patients to influence triage decisions that affected the survival prospects of multiple casualties. The operational timeline called for insertion at 0400 hours, allowing the Marine Force to establish defensive positions during the hours before dawn when coalition forces possessed maximum advantages through superior night vision equipment and air support capabilities. Medical personnel would accompany their assigned elements during the initial insertion phase, then establish aid stations at predetermined locations that would provide centralized treatment facilities for casualties. From throughout the operational area, communication protocols ensured that medical personnel could coordinate treatment decisions and request evacuation support through encrypted radio networks that would remain functional even if individual aid stations were overrun or destroyed. Sarah spent the evening before the operation conducting final equipment checks and reviewing medical procedures that she might need to implement under combat conditions. Her medical kit had been carefully configured to provide maximum treatment capabilities while remaining light enough to carry during extended foot movements across difficult terrain. Every item served multiple purposes with weight and space. limitations requiring careful decisions about which equipment to include and which to leave behind. Sarah had chosen to carry additional pain medication and wound dressing materials at the expense of some diagnostic equipment, reflecting her belief that comfort care and bleeding control would be her primary responsibilities during sustained combat operations. The helicopter insertion began exactly on schedule, with 4 CH-47 Chinook helicopters carrying the Marine Force toward landing zones that had been selected based on intelligence assessments and terrain analysis conducted by specialized reconnaissance teams. Sarah rode in the lead aircraft with 37 Marines from Alpha Company's 1st Platoon, the noise of the helicopter's twin rotors making conversation impossible while creating an environment of controlled tension that reflected every passenger's awareness of the dangers awaiting them in the valley below. The flight lasted 43 minutes, carrying the force over mountainous terrain that provided natural concealment while exposing the helicopters to potential ground fire from insurgent positions that might have been established along known flight routes. Lieutenant Colonel James Wright, the Marine officer commanding the operation, had stressed during pre-mission briefings that intelligence about enemy strength and positions in the Sangin Valley remained incomplete, requiring all personnel to expect contact immediately upon landing and to maintain maximum tactical alertness throughout the insertion phase. Recent insurgent attacks against coalition forces in adjacent areas suggested that Taliban commanders possess detailed knowledge of coalition tactics and equipment, potentially including information about medical procedures and evacuation protocols that could be exploited to increase casualties during sustained engagements. The landing zone occupied a relatively flat area surrounded by low hills that provided both concealment for the Marine Force and potential observation positions for enemy forces monitoring coalition activities. Sarah disembarked from the helicopter with her assigned platoon and immediately took cover behind a low stone wall that offered protection from small arms fire while providing her with observation of the area where medical treatment would most likely be required if the insertion was opposed by enemy forces. The helicopters departed quickly after unloading their passengers, leaving the Marine Force alone in territory where the nearest friendly units were more than 50 kilometers away, and immediate support would depend entirely on air assets that might not be available if weather conditions deteriorated or if higher priority missions required their deployment elsewhere. The first indication that the operation would not proceed according to plan came 37 minutes after insertion, when the Point Squad reported movement in the hills surrounding the landing zone. Staff Sergeant Rodriguez, leading the platoon's advance element, transmitted a brief radio message indicating that his Marines had observed what appeared to be armed individuals moving through positions that would provide excellent fields of fire against the newly established coalition positions. The contact report was followed by confirmation from other observation posts that insurgent forces were maneuvering to surround the Marine positions, suggesting that the landing had been detected and that enemy forces were implementing prepared plans for engaging coalition forces in the valley. Sarah monitored the tactical radio network while conducting final preparations of her aid station, listening to reports from squad leaders that painted an increasingly ominous picture of enemy activity throughout the valley. Insurgent forces appeared to be more numerous and better organized than intelligence estimates had suggested, with coordinated movement patterns indicating professional military training rather than the amateur tactics typically employed by local Taliban fighters. The radio report suggested that the Marine Force was facing a planned ambush by experienced fighters who possessed detailed knowledge of coalition insertion procedures and had prepared defensive positions specifically designed to inflict maximum casualties during the vulnerable period immediately following helicopter operations. Lieutenant Sarah Morrison, the platoon commander responsible for the lead element, requested permission to withdraw to more defensible positions, but was ordered to maintain current locations to support the insertion of follow-on forces that were already airborne and approaching the valley. The tactical situation required the Marines to hold positions that were tactically disadvantageous, while additional personnel and equipment were brought into the operational area, creating conditions that would test every aspect of their training and equipment under circumstances that favored well-prepared defenders operating on familiar terrain. The opening shots of what would become a 14-hour firefight erupted from multiple directions simultaneously, with insurgent forces initiating contact using automatic weapons, rocket-propelled grenades, and mortar that had been pre-positioned to cover all likely coalition positions within the landing zone. The coordinated nature of the initial attack confirmed that enemy forces had observed the Marine insertion and had sufficient time to organize a comprehensive assault designed to destroy the coalition force before reinforcements could arrive or effective defensive positions could be established. Sarah's first casualty arrived less than 3 minutes after the engagement began, carried to her position by 2 Marines who had dragged their wounded squad leader away from the exposed position, where he had been struck by fragments from a rocket-propelled grenade that had detonated against the stone wall he had been using for cover. Lance Corporal Michael Santos had suffered penetrating wounds to his abdomen and left leg, with significant bleeding that required immediate intervention to prevent shock and potential death from blood loss. Santos remained conscious, but was experiencing severe pain and showed signs of internal injuries that could prove fatal if not treated quickly and professionally. Sarah's initial assessment of Santos revealed injuries that exceeded the scope of treatments she could provide in the field, requiring immediate evacuation to surgical facilities if he was to survive. However, the intensity of enemy fire made helicopter evacuation impossible, forcing Sarah to provide definitive treatment using only the equipment and supplies available in her medical kit. She began treatment by establishing intravenous access and administering pain medication while applying pressure dressings to control external bleeding and conducting a systematic assessment of Santos's condition that would guide her treatment decisions during what could be many hours of sustained combat. The second casualty arrived while Sarah was still treating Santos, creating the first test of her ability to manage multiple patients simultaneously while under enemy fire. Corporal Jennifer Adams had been struck in the shoulder by small arms fire that had shattered her collarbone and created a complex wound involving muscle, bone, and vascular structures that required immediate attention to prevent permanent disability or death from blood loss. Adams remained conscious and alert, but was experiencing significant pain and showed signs of shock that indicated her condition was serious despite the absence of immediately life-threatening injuries. Sarah's triage training had prepared her for situations involving multiple casualties with varying degrees of injury severity, requiring rapid assessment and treatment prioritization that would maximize survival prospects for all patients, while recognizing that available resources might be insufficient to provide optimal care for everyone. The textbook approach to triage emphasized treating patients with the highest probability of survival first, potentially sacrificing individuals with more severe injuries if their treatment would consume resources needed to save multiple less severely injured patients. However, Sarah's emotional attachment to both Marines made it impossible for her to implement purely clinical triage protocols that would abandon Santos despite his more severe injuries. Instead of following standard triage procedures, Sarah attempted to provide simultaneous treatment for both casualties while maintaining constant assessment of their conditions and adjusting treatment priorities based on immediate medical needs, rather than long-term survival probabilities. She positioned Santos and Adams adjacent to each other behind the stone wall that provided the best available cover from enemy fire, allowing her to move between patients while maintaining protection from the small arms fire that continued to impact around their position with deadly consistency. The intensity of enemy fire prevented other Marines from providing assistance with casualty care, forcing Sarah to work alone while her patient's squad mates maintained defensive positions. That prevented insurgent forces from overrunning the aid station. The tactical situation meant that Sarah could not call for additional medical personnel or request evacuation support, requiring her to provide definitive treatment for conditions that would normally be handled by surgical teams in sterile hospital environments. Her medical kit contained sufficient supplies for treating several casualties, but managing 2 seriously wounded Marines while under fire tested every aspect of her training and personal resolve. Sarah's treatment of Santos focused on controlling bleeding and maintaining blood pressure while monitoring for signs of internal injuries that could prove fatal without surgical intervention. She administered intravenous fluids to replace blood loss while applying direct pressure to wounds and positioning Santos to minimize the risk of shock while maintaining his airway and breathing. The treatment required constant attention and frequent reassessment, consuming time and mental energy that made it difficult to provide simultaneous care for Adams while maintaining awareness of the tactical situation developing around their position. Adams's shoulder wound required different treatment approaches, with Sarah applying pressure dressings to control bleeding while immobilizing the injured arm to prevent further damage to fractured bones and torn muscles. Adams remained conscious and conversational, allowing Sarah to gather information about her pain levels and symptoms that guided treatment decisions. However, the complexity of the wound and the possibility of vascular damage meant that Adams required careful monitoring and potentially surgical treatment that Sarah could not provide under current conditions. The third casualty presented Sarah with her first true triage dilemma when Private First Class Robert Kim was carried to her position with severe burns covering 30% of his body, including his face and hands. Kim had been injured when an insurgent mortar round had detonated near a fuel storage area, creating a fire that had engulfed his position before he could escape to safety. His injuries were immediately life-threatening and would require specialized burn treatment that was beyond Sarah's capabilities even under ideal conditions. However, Kim was conscious and pleading for help, creating an emotional situation that tested Sarah's ability to make clinical decisions based on medical priorities rather than personal feelings. Traditional triage protocols would classify Kim as expectant, meaning that his injuries were so severe that medical resources would be better utilized treating patients with higher survival probabilities. Santos and Adams both had injuries that were manageable with available equipment and supplies, while Kim required specialized treatment that Sarah could not provide regardless of how much time and resources she devoted to his care. The logical medical decision would be to make Kim as comfortable as possible, while focusing treatment efforts on Santos and Adams, who had reasonable prospects for survival if provided with competent medical care. Sarah's emotional response to Kim's situation reflected the compassionate nature that her colleagues had identified as a liability for combat medicine. She could not bring herself to abandon a conscious patient who was asking for help, even though treating Kim would consume time and resources that might be needed to save Santos and Adams. Her decision to attempt treatment for all 3 casualties violated standard triage principles and potentially compromised the survival prospects of patients who might have lived with more focused medical attention. However, Sarah's approach to treating Kim demonstrated the innovative thinking that emotional investment could inspire when applied to seemingly hopeless medical situations. Instead of providing conventional burn treatment that would have been ineffective given her limited resources, Sarah focused on pain management and respiratory support while developing creative approaches to wound care using available materials in ways that textbooks had never suggested. Her emotional commitment to saving Kim motivated her to explore treatment options that more detached medics might have dismissed as impossible or impractical. The 4th casualty arrived as enemy fire intensified around Sarah's position, with Sergeant David Thompson suffering a penetrating head wound that would have been immediately fatal if the bullet had struck 3 inches lower. Thompson remained conscious but disoriented, with bleeding from his scalp that created the appearance of more severe injuries than he had actually sustained. Sarah's rapid assessment revealed that the wound was superficial despite its dramatic appearance, requiring careful cleaning and bandaging, but not presenting immediate threats to Thompson's life or long-term health. Thompson's injury allowed Sarah to demonstrate her diagnostic skills under pressure, quickly differentiating between wounds that appeared severe but were actually manageable and injuries that presented genuine medical emergencies, requiring immediate intervention. Her ability to make rapid, accurate assessments became increasingly important as additional casualties arrived at her position, creating situations where treatment prioritization could mean the difference between life and death for multiple patients. The 5th and 6th casualties arrived simultaneously when an insurgent rocket-propelled grenade detonated near a Marine fighting position, wounding both occupants with fragmentation injuries that required immediate medical attention. Lance Corporal Maria Gonzalez had suffered penetrating wounds to her chest that potentially involved lung damage, while Private Timothy Johnson had multiple fragments embedded in his legs and abdomen that created significant bleeding and pain, but did not appear to involve vital organs or major blood vessels. Sarah's medical training had prepared her to handle multiple trauma patients, but the reality of treating 6 seriously wounded Marines while under sustained enemy fire exceeded any scenario she had experienced during training exercises. The noise of gunfire and explosions made communication difficult, while the constant threat of additional casualties required her to work quickly while maintaining the highest possible standards of medical care. The psychological pressure of knowing that mistakes could result in unnecessary deaths added another dimension of stress that tested her emotional resilience and professional competence simultaneously. Gonzalez's chest wound required immediate attention to prevent tension pneumothorax, a condition that could cause rapid death if not treated within minutes of onset. Sarah performed a needle thoracostomy using equipment from her medical kit, relieving pressure that had been building in Gonzalez's chest cavity, while monitoring her vital signs for indications of additional complications that might require further intervention. The procedure had to be performed while lying prone behind the stone wall, with enemy bullets impacting around their position and fragments of stone and concrete flying through the air from near misses. Johnson's multiple fragment wounds required systematic examination to identify injuries that might be more serious than their external appearance suggested. Sarah conducted a rapid trauma assessment while applying pressure dressings to control bleeding, prioritizing wounds based on their potential for causing rapid deterioration or permanent disability. The treatment required her to remain focused on medical priorities while blocking out the chaos and violence surrounding their position, demonstrating the emotional control that her colleagues had doubted she possessed. The arrival of additional casualties during the following hour tested Sarah's organizational abilities as she struggled to maintain situational awareness of 6 patients with varying degrees of injury severity, while continuing to provide active treatment for conditions that required constant monitoring and frequent intervention. Santos required ongoing intravenous fluid administration and pain management, while Adams needed periodic reassessment of her shoulder wound and monitoring for signs of vascular compromise. Kim's burn injuries demanded frequent wound care and respiratory monitoring, while Gonzalez required continuous observation for signs of recurrent pneumothorax or other pulmonary complications. Thompson and Johnson represented lower treatment priorities, but both required periodic assessment and wound care that consumed time and attention. Sarah needed for more seriously injured patients. The challenge of managing multiple patients simultaneously while under fire required organizational skills and time management abilities that had not been emphasized during her medical training. forcing Sarah to develop new approaches to patient care that maximized efficiency while maintaining quality standards. Sarah's solution involved creating a systematic rotation that allowed her to provide brief but focused attention to each patient every 15 minutes while spending concentrated time with the most seriously injured Marines when their conditions required immediate intervention. The approach required careful time management and constant prioritization, but allowed her to maintain awareness of all 6 patients while providing adequate treatment for their various conditions. Her ability to function effectively under these conditions demonstrated organizational abilities that exceeded the capabilities typically expected from junior medical personnel. The tactical situation around Sarah's aid station continued to deteriorate as insurgent forces maintained pressure on Marine positions while additional enemy fighters moved into the valley to reinforce the initial assault force. Radio communications indicated that other elements of the Marine Company were also receiving heavy contact, with multiple casualties reported from positions throughout the operational area. The intensity and coordination of the enemy assault suggested that coalition forces were facing a significantly larger and more capable insurgent force than intelligence estimates had indicated. Major Anderson's voice on the radio reflected the stress of commanding a force that was outnumbered and outgunned while operating in terrain that favored well-prepared defenders. Her requests for air support were being delayed by weather conditions and competing priority missions, forcing the Marine Company to rely on organic firepower and tactical skills while awaiting reinforcement or evacuation that might not arrive for many hours. The radio traffic painted a picture of a force that was holding its positions through determination and training rather than superior equipment or tactical advantage. Sarah's position became increasingly untenable as insurgent forces concentrated fire on areas where they suspected medical treatment was being provided. Enemy fighters had apparently observed the movement of wounded Marines towards Sarah's aid station and were deliberately targeting the area in violation of international laws governing the treatment of medical personnel during armed conflict. The targeting forced Sarah to move her patients to positions that provided better concealment while maintaining her ability to provide medical treatment under increasingly dangerous conditions. The 7th casualty arrived when Corporal Lisa Rodriguez was struck by sniper fire that created a through-and-through wound in her abdomen, potentially involving intestinal damage that could prove fatal without surgical intervention. Rodriguez remained conscious and alert, but was experiencing severe pain and showed signs of internal bleeding that required immediate treatment to prevent shock and death. Her injury represented the type of complex trauma that would challenge Sarah's medical skills while adding another patient to an already overwhelming caseload. Sarah's assessment of Rodriguez revealed injuries that were potentially more serious than those of her other patients, requiring immediate treatment decisions about resource allocation and treatment priorities. Rodriguez's condition demanded intensive monitoring and potentially surgical intervention that Sarah could not provide, while her other patients required continued care that prevented her from devoting exclusive attention to the newest casualty. The situation forced Sarah to make exactly the type of triage decisions that her colleagues had doubted she could handle under pressure. Instead of abandoning any of her patients or providing substandard care to accommodate Rodriguez's needs, Sarah developed a modified treatment approach that allowed her to provide intensive care for Rodriguez while maintaining adequate treatment for all of her other patients. Her solution involved repositioning her aid station to create better working conditions, while establishing treatment protocols that maximized efficiency without compromising medical standards. The approach required innovative thinking and careful planning that demonstrated problem-solving abilities that exceeded standard medical training. Sarah's treatment of Rodriguez focused on controlling internal bleeding through proper positioning and fluid replacement while monitoring for signs of shock or other complications that might indicate deteriorating condition requiring immediate surgical intervention. She established large-bore intravenous access and began aggressive fluid resuscitation while conducting systematic abdominal examination that would guide her treatment decisions during what could be many hours before evacuation became possible. The 8th and 9th casualties arrived together when an insurgent mortar round detonated near a Marine observation post, wounding both sentries with fragmentation injuries that required immediate medical attention. Staff Sergeant Michael Davis had suffered multiple fragment wounds to his back and legs, while Lance Corporal Jennifer Martinez had penetrating wounds to her arm and shoulder that potentially involved nerve damage requiring specialized treatment to prevent permanent disability. Sarah's aid station now housed 9 seriously wounded Marines whose combined medical needs exceeded the treatment capabilities that any single medic could reasonably be expected to provide under optimal conditions. The challenge of managing so many patients simultaneously while under sustained enemy fire represented a test of medical skills, organizational abilities, and emotional resilience that went far beyond normal training scenarios. Sarah's colleagues had questioned whether she possessed the emotional detachment necessary for effective triage, but her current situation required exactly the opposite qualities: the passionate commitment, creative thinking that came from emotional investment in patient outcomes. Davis's back wounds required careful examination to rule out spinal cord damage, while treating multiple penetrating injuries that created significant bleeding and pain. Sarah conducted neurological assessment while applying pressure dressings, confirming that Davis retained sensation and movement in his lower extremities, despite the dramatic appearance of his injuries. The assessment required systematic examination techniques while maintaining constant awareness of her other patients' conditions and needs. Martinez's arm injury presented potential complications involving nerve and vascular damage that could result in permanent disability if not treated appropriately. Sarah conducted detailed assessment of sensation, circulation, and movement while applying pressure dressings and immobilizing the injured extremity. The treatment required careful positioning and frequent monitoring that added another layer of complexity to her already overwhelming patient management responsibilities. The 10th casualty challenged Sarah's emotional resilience when 19-year-old Private First Class Andrew Thompson arrived at her aid station with severe facial injuries that had destroyed his left eye and created massive soft tissue damage that would require extensive reconstructive surgery. Thompson remained conscious and was asking repeatedly whether he would be permanently disfigured, creating an emotionally charged situation that tested Sarah's ability to provide honest information while maintaining hope and motivation necessary for his recovery. Sarah's response to Thompson's situation demonstrated the benefits of emotional engagement that her colleagues had failed to recognize. Instead of providing clinical detachment that might have been technically correct but emotionally devastating, Sarah offered honest assessment combined with genuine compassion that helped Thompson cope with his injuries while maintaining the psychological resilience necessary for his physical recovery. Her approach required balancing medical honesty with emotional support, providing information that Thompson needed while avoiding unnecessary psychological trauma. Thompson's injuries required immediate treatment to control bleeding and protect his remaining eye from further damage, while providing pain management and emotional support that would help him cope with life-changing trauma. Sarah's treatment focused on preserving vision in his uninjured eye while cleaning and bandaging facial wounds that would require extensive surgical reconstruction. The treatment demanded technical skill combined with emotional sensitivity that demonstrated the complementary relationship between medical competence and compassionate care. The 11th and 12th casualties arrived as the firefight entered its 6th hour, with both Marines suffering from heat exhaustion and dehydration that had been exacerbated by stress and the physical demands of sustained combat operations. Corporal James Wilson and Private First Class Rebecca Chen had collapsed while manning defensive positions, requiring immediate cooling and fluid replacement to prevent progression to potentially fatal heat stroke. Sarah's treatment of heat-related injuries required different approaches than trauma care, focusing on temperature reduction and fluid replacement, while monitoring for complications that could indicate organ damage or neurological compromise. The treatment demanded careful attention to cooling techniques and fluid balance while maintaining awareness of her trauma patients who continued to require active medical intervention and monitoring. Wilson and Chun's conditions represented medical emergencies that could prove fatal without appropriate treatment, but also demonstrated injuries that were entirely preventable through proper hydration and heat management protocols. Sarah's treatment focused on immediate cooling and fluid replacement while educating both Marines about heat injury prevention that would reduce their risk of recurrence during continued combat operations. The 13th casualty arrived when Sergeant Patricia Davis was wounded by fragments from an insurgent grenade that had been thrown into her fighting position during a close-range engagement with enemy forces attempting to overrun Marine defensive positions. Davis had suffered multiple penetrating wounds to her torso and arms, with significant bleeding that required immediate intervention to prevent shock and death from blood loss. Davis's injuries represented some of the most serious trauma Sarah had encountered during the engagement, requiring immediate treatment decisions about resource allocation and treatment priorities. Davis remained conscious, but was showing signs of shock that indicated her condition was rapidly deteriorating, demanding intensive medical intervention that would consume significant time and resources while potentially compromising Sarah's ability to provide adequate care for her other patients. Sarah's treatment of Davis demonstrated her ability to make difficult triage decisions based on medical priorities rather than emotional factors, providing intensive care for the patient who needed immediate intervention while maintaining adequate treatment for all of her other casualties. Her approach required systematic thinking and careful resource management that maximized survival prospects for all of her patients, rather than focusing exclusively on individual cases. The 14th and 15th casualties arrived simultaneously when an insurgent rocket-propelled grenade detonated near a Marine command post, wounding both the radio operator and his assistant with fragmentation injuries that required immediate medical attention. Lance Corporal Stephen Martinez had suffered penetrating wounds to his chest and abdomen, while Private William Rodriguez had multiple fragment wounds to his legs and arms that created significant bleeding and pain. Martinez's chest wound required immediate assessment for potential lung damage while treating abdominal injuries that might involve internal organs requiring surgical intervention. Sarah conducted rapid trauma evaluation while establishing intravenous access and applying pressure dressings, prioritizing treatments based on immediate threats to life while planning for extended patient management during continued combat operations. Rodriguez's extremity wounds required systematic examination to identify injuries involving major blood vessels or nerves that could result in permanent disability if not treated appropriately. Sarah conducted detailed assessment while applying pressure dressings and immobilizing injured extremities, providing treatment that would preserve function while managing pain and preventing complications during extended evacuation delays. As the firefight continued into its 8th hour, Sarah found herself managing 15 seriously wounded Marines, whose combined medical needs represented a caseload that would challenge the resources of a fully staffed emergency department operating under optimal conditions. Her aid station had evolved from a simple treatment area into a complex medical facility, where systematic patient management and resource allocation determined survival prospects for multiple critically injured patients. Sarah's approach to managing her overwhelming patient load demonstrated organizational abilities and clinical skills that exceeded normal expectations for junior medical personnel operating under combat conditions. Her emotional investment in patient outcomes had motivated innovative treatment approaches and creative problem-solving that achieved results superior to what detached clinical care might have accomplished. The passionate commitment that her colleagues had identified as a weakness had proven to be her greatest strength when facing impossible medical challenges under the worst possible conditions. The tactical situation around Sarah's position remained critical as insurgent forces maintained pressure on Marine defensive positions while continuing to target areas where medical treatment was being provided. Enemy fighters had demonstrated sophisticated understanding of coalition medical procedures, deliberately targeting medical personnel and evacuation areas in violation of international law. The targeting forced Sarah to balance patient care requirements against security considerations that could affect the survival of her patients and herself. Radio communications indicated that other medical personnel throughout the company's operational area were also dealing with significant casualty loads, confirming that the entire Marine force was facing a level of enemy resistance that exceeded intelligence estimates and operational planning assumptions. The coordinated nature of the insurgent assault had created multiple crisis situations simultaneously, stretching medical resources beyond their designed capabilities while testing the limits of training and equipment under the most demanding possible conditions. Sarah's performance during the first 8 hours of combat had already exceeded every standard that her colleagues had established for evaluating combat medic effectiveness under pressure. She had demonstrated technical competence, organizational ability, and emotional resilience that contradicted every assumption about the relationship between compassionate care and clinical effectiveness. Her patients remained alive and stable despite injuries that would have challenged the resources of advanced medical facilities, proving that emotional investment could enhance rather than compromise medical performance under extreme conditions. The night was far from over, and Sarah's greatest challenges still lay ahead as the firefight continued with undiminished intensity, while her patient load continued to grow beyond any reasonable expectation for single medic management. Her reputation among the base's medical personnel would be permanently transformed by sunrise, but only if she could maintain the same level of performance throughout many more hours of sustained combat while treating casualties whose survival depended entirely on her skill, determination, and the compassionate heart that had made her colleagues doubt her suitability for combat medicine. The insurgent assault intensified as dawn approached, transforming the Sangdon Valley into a killing field where every shadow concealed potential death and every sound carried the promise of incoming fire. Sarah's aid station had become the epicenter of a desperate struggle for survival, with 15 wounded Marines depending entirely on her ability to maintain their lives while enemy forces systematically targeted medical positions with increasing accuracy and determination. The stone wall that had provided initial protection now showed multiple impact craters, where rocket-propelled grenades had detonated, showering the area with concrete fragments that added new hazards to an already impossible situation. The 16th casualty arrived as enemy mortar fire began falling with mathematical precision around Marine positions, each round adjusted based on previous impacts until the explosions walked steadily towards Sarah's overcrowded aid station. Corporal Michelle Parker had been struck by shrapnel from the first mortar round to impact near the medical area, suffering penetrating wounds to her back and legs that required immediate assessment for spinal cord damage while treating multiple bleeding sites that could prove fatal if not controlled quickly. Parker remained conscious, but reported complete loss of sensation below her waist, indicating potential spinal cord injury that would require specialized treatment Sarah could not provide under current conditions. Sarah's examination of Parker revealed the complexity of treating spinal injuries in combat environments, where proper immobilization and diagnostic capabilities were unavailable. She conducted systematic neurological assessment while applying pressure dressings to bleeding wounds, confirming that Parker had lost motor function and sensation in her lower extremities despite maintaining normal reflexes in her upper body. The assessment required careful positioning and gentle manipulation that protected Parker's spine from further damage while providing necessary medical treatment for her other injuries. Parker's spinal injury presented Sarah with her most challenging triage decision yet, requiring treatment approaches that consumed significant time and resources while potentially offering limited prospects for meaningful recovery even under optimal medical conditions. Traditional triage protocols would classify Parker as a low-priority patient whose treatment should be delayed until higher-priority casualties had received care. But Sarah's emotional connection with all of her patients made it impossible to abandon someone who was conscious and asking for help. The 17th and 18th casualties arrived together when a coordinated insurgent assault overran an outlying observation post, forcing the two Marine sentries to fight their way back to friendly lines while suffering multiple gunshot wounds. During their withdrawal under fire, Lance Corporal Kevin Washington had been struck twice in the torso, with entry and exit wounds indicating that at least one bullet had passed through his chest cavity, potentially damaging vital organs. Private First Class Amanda Foster had suffered a single gunshot wound to her thigh that had fractured her femur while creating massive soft tissue damage and arterial bleeding that required immediate intervention to prevent death from blood loss. Washington's chest wounds required immediate assessment for lung damage and internal bleeding that could prove rapidly fatal without surgical intervention. Sarah conducted rapid trauma evaluation while establishing intravenous access and monitoring vital signs that would indicate deteriorating condition requiring emergency procedures she was barely qualified to perform under ideal conditions. Washington remained conscious, but was experiencing difficulty breathing and showed signs of shock that suggested his injuries were more serious than their external appearance indicated. Foster's thigh wound had severed her femoral artery, creating arterial bleeding that could cause death within minutes, if not controlled immediately through direct pressure and proper positioning. Sarah applied emergency hemorrhage control techniques, while establishing large-bore intravenous access for aggressive fluid resuscitation, working frantically to stabilize Foster's condition, while maintaining awareness of her 17 other patients who continued to require active medical intervention and constant monitoring. The tactical situation deteriorated further when insurgent forces began employing thermal imaging equipment to identify heat signatures from wounded Marines, allowing enemy snipers to target medical areas with precision that suggested professional military training and advanced equipment. Sarah observed muzzle flashes from elevated positions that provided commanding views of the entire valley, confirming that enemy forces had established overwatch positions during the hours of darkness while Marine attention was focused on treating casualties and maintaining defensive positions. The 19th casualty presented unique challenges when Staff Sergeant Robert Chen arrived at Sarah's aid station with severe psychological trauma that had rendered him unable to function effectively. Despite the absence of visible physical injuries, Chen had witnessed the death of his entire squad during the insurgent assault on the observation post, experiencing trauma that had triggered complete emotional breakdown requiring immediate psychological intervention in addition to standard medical assessment for potential physical injuries that might not be immediately apparent. Sarah's treatment of Chen required different skills than trauma medicine, focusing on psychological stabilization and emotional support while conducting systematic physical examination to rule out head injuries or other trauma that might be contributing to his psychological symptoms. Chen was conscious but unresponsive to verbal commands, showing signs of severe dissociation that indicated psychological trauma requiring specialized treatment that Sarah had received minimal training to provide. Chen's condition forced Sarah to expand her medical practice beyond physical trauma to encompass psychological injuries that could prove as debilitating as penetrating wounds or broken bones. Her approach emphasized emotional support and reassurance, while creating a safe environment where Chen could begin processing traumatic experiences without additional psychological stress. The treatment required patience and understanding that consumed time Sarah desperately needed for treating physical injuries in her other patients. The 20th and 21st casualties arrived when an insurgent suicide bomber detonated an explosive vest near a Marine checkpoint, wounding both guards with blast injuries that created complex trauma involving burns, fragmentation wounds, and potential brain injury from explosive concussion. Corporal Jason Martinez had suffered severe burns to his face and hands, along with multiple fragment wounds that required immediate assessment for internal injuries. Private Daniel Kim had been thrown against a concrete barrier by the blast, suffering head trauma and multiple fractures that required careful evaluation for brain injury and spinal damage. Martinez's burn injuries represented the second severe burn case Sarah had treated during the engagement, requiring specialized wound care and pain management using limited supplies that were being rapidly depleted by her growing patient load. His fragmentation wounds demanded systematic examination to identify internal injuries while providing treatment for burns that covered significant portions of his body and face. The combination of injuries required multiple treatment approaches simultaneously while maintaining awareness of potential complications that could develop during extended treatment periods. Kim's head injury required constant neurological monitoring, while treating multiple fractures that could indicate internal injuries requiring surgical intervention. Sarah conducted systematic neurological assessment while immobilizing suspected fractures and establishing intravenous access for medications that might be needed if his condition deteriorated. Kim remained unconscious with vital signs that suggested possible brain injury requiring immediate evacuation to neurosurgical facilities that were hours away even under optimal conditions. The 22nd casualty arrived as enemy fire intensified around Sarah's position, with Sergeant Lisa Thompson suffering multiple gunshot wounds during her attempt to reach the aid station with medical supplies that had been requested through radio communications. Thompson had been struck 3 times while crossing open ground under enemy observation, sustaining wounds to her abdomen, arm, and leg that required immediate treatment to prevent death from blood loss and shock. Thompson's multiple gunshot wounds represented complex trauma that would challenge the resources of any medical facility, requiring simultaneous treatment for injuries affecting different body systems while maintaining constant monitoring for complications that could prove fatal without immediate surgical intervention. Sarah conducted rapid trauma assessment while establishing multiple intravenous access points and applying pressure dressings to control bleeding from wounds that had created significant tissue damage and potential organ injury. Thompson remained conscious despite her severe injuries, providing Sarah with valuable information about her pain levels and symptoms while helping to coordinate treatment efforts with the Marine security element that maintained defensive positions around the increasingly crowded aid station. Thompson's medical knowledge as a trained combat lifesaver allowed her to assist with treatment decisions while receiving care for her own life-threatening injuries. The 23rd and 24th casualties presented Sarah with identical injuries when both Marines were wounded by the same sniper bullet that passed through Lance Corporal Mark Davis before striking Private Rachel Johnson. The single shot had created through-and-through wounds in Davis's shoulder while causing a graze wound across Johnson's ribs, demonstrating the precision and skill of enemy marksmen who were systematically targeting Marine positions from concealed locations throughout the valley. Davis's shoulder wound had caused significant bone and soft tissue damage, while potentially affecting nerve function that could result in permanent disability if not treated appropriately. Sarah conducted detailed assessment of sensation and movement while applying pressure dressings and immobilizing the injured extremity, providing treatment that would preserve function while managing pain and preventing complications during extended evacuation delays. Johnson's rib wound appeared superficial but required careful examination to rule out lung damage or internal injuries. that might not be immediately apparent. Sarah conducted systematic assessment while applying appropriate dressings, confirming that Johnson had not suffered penetrating chest trauma despite the dramatic appearance of her wound. The assessment required careful observation and repeated evaluation to ensure that apparent minor injuries did not mask more serious underlying trauma. The 25th casualty challenged Sarah's organizational abilities when Corporal David Wilson arrived at her aid station with multiple fragment wounds from an insurgent hand grenade while simultaneously requiring assistance, coordinating fire. Support that was being directed against enemy positions threatening the medical area. Wilson remained capable of functioning despite his injuries, providing valuable tactical information while receiving medical treatment for wounds that would have incapacitated less experienced Marines. Wilson's dual role as patient and tactical coordinator required Sarah to balance medical treatment against Wilson's need to maintain communication with supporting elements that were providing defensive fire for the aid station. His fragment wounds required systematic examination and treatment while allowing him to continue performing duties that were critical for the survival of everyone in the medical area. The situation demonstrated the complex relationships between medical care and tactical operations in combat environments where personnel had to fulfill multiple roles simultaneously. Sarah's treatment approach accommodated Wilson's tactical responsibilities while providing appropriate medical care for injuries that required attention to prevent infection and complications during extended operations. She established treatment priorities that allowed Wilson to maintain communication capabilities while receiving wound care that addressed his medical needs without compromising his ability to coordinate defensive activities. The 26th casualty arrived when Private Jennifer Chen was wounded by insurgent small arms fire while attempting to resupply ammunition to Marines defending the perimeter around Sarah's aid station. Chen had suffered a single gunshot wound to her abdomen that required immediate assessment for internal organ damage, while treating external bleeding that indicated potential arterial involvement requiring emergency surgical intervention. Chen's abdominal wound presented the type of complex trauma that exceeded Sarah's training and equipment capabilities, requiring surgical exploration and repair that could only be provided at advanced medical facilities with specialized equipment and surgical teams. However, the tactical situation made evacuation impossible, forcing Sarah to provide definitive treatment using field expedient techniques and equipment that had never been intended for managing such serious injuries. Sarah's approach to treating Chen involved innovative applications of available materials and techniques, developing treatment approaches that pushed the boundaries of field medicine while maintaining the highest possible standards of care given resource limitations. Her emotional investment in Chen's survival motivated creative thinking and problem-solving that achieved results superior to standard protocols designed for conventional medical facilities. The 27th and 28th casualties arrived together when an insurgent mortar round detonated directly in a Marine fighting position, wounding both occupants with blast injuries that created complex trauma involving multiple body systems. Staff Sergeant Michael Rodriguez had suffered severe blast injuries to his legs and abdomen, while Lance Corporal Sandra Williams had sustained head trauma and multiple fractures from being thrown against rocks by the explosion, Rodriguez's blast. Injuries required immediate assessment for internal bleeding and organ damage, while treating severe trauma to his lower extremities that had created massive tissue destruction and bone damage. Sarah conducted systematic evaluation while establishing aggressive intravenous fluid resuscitation and applying pressure dressings to control bleeding from wounds that would require extensive surgical reconstruction if Rodriguez survived long enough to reach appropriate medical facilities. Williams's head injury required constant neurological monitoring while treating multiple fractures that indicated the severity of trauma she had sustained during the blast. Sarah conducted repeated neurological assessments while immobilizing suspected fractures and establishing intravenous access for medications that might be needed if Williams's condition deteriorated. Williams remained unconscious with vital signs that suggested possible brain injury requiring immediate neurosurgical intervention. The 29th casualty presented psychological as well as physical challenges when 19-year-old Private Timothy Foster arrived at Sarah's aid station with severe facial injuries that had destroyed most of his jaw and created massive soft tissue damage requiring extensive reconstructive surgery. Foster remained conscious and was attempting to communicate despite his inability to speak clearly, creating an emotionally charged situation that tested Sarah's ability to provide reassurance while delivering necessary medical treatment. Foster's facial injuries required immediate airway management to prevent respiratory compromise while treating massive bleeding and tissue damage that would require multiple surgical procedures for reconstruction. Sarah established emergency airway access while applying pressure dressings and providing pain management that would help Foster cope with life-changing trauma. The treatment required technical skill combined with emotional sensitivity that demonstrated the benefits of compassionate medical care under extreme conditions. Foster's psychological response to his injuries required constant reassurance and emotional support that consumed time Sarah desperately needed for treating other critically injured patients. However, her investment in Foster's emotional well-being contributed to his physical recovery by maintaining his will to survive and cooperate with treatment efforts that would determine his long-term prognosis. The 30th casualty arrived as the firefight entered its 10th hour, with Corporal Amanda Washington suffering from severe dehydration and heat exhaustion that had progressed to heat stroke requiring immediate cooling and fluid replacement to prevent organ damage and potential death. Washington had collapsed while manning a defensive position, requiring immediate evacuation to Sarah's aid station for treatment that would address both her heat-related injuries and potential underlying medical conditions that might have contributed to her collapse. Washington's heat stroke required different treatment approaches than trauma care, focusing on aggressive cooling and careful fluid replacement, while monitoring for complications that could indicate organ damage or neurological compromise. Sarah applied cooling techniques using available water and equipment, while establishing intravenous access for fluid replacement that would restore Washington's fluid balance without causing additional medical complications. The treatment required constant monitoring and frequent reassessment as Washington's condition fluctuated between improvement and deterioration, demanding attention that Sarah struggled to provide while managing 29 other patients with varying degrees of injury severity. Washington's case demonstrated the importance of preventive medicine and proper hydration protocols that could reduce medical casualties during sustained combat operations. The 31st and 32nd casualties arrived simultaneously when an insurgent rocket-propelled grenade detonated near a Marine command post, wounding both the company commander and his radio operator with fragmentation injuries that created immediate command and control problems in addition to medical emergencies. Major Patricia Anderson had suffered multiple fragment wounds to her torso and extremities while maintaining consciousness and attempting to coordinate defensive operations despite her injuries. Anderson's dual role as patient and commander created unique challenges for Sarah's treatment approach, requiring medical care that accommodated the major's need to maintain command authority while providing appropriate treatment for injuries that could prove serious if not addressed promptly. Anderson's fragment wounds required systematic examination while allowing her to continue coordinating tactical operations that were critical for the survival of the entire Marine force. The radio operator, Corporal Stephen Martinez, had suffered more serious injuries including penetrating wounds to his chest and abdomen that required immediate assessment for internal organ damage while maintaining communication equipment that was essential for coordinating fire support and evacuation requests. Martinez remained conscious but was experiencing difficulty breathing and showed signs of internal bleeding that required immediate surgical intervention. Sarah's treatment of both casualties required balancing medical priorities against tactical necessities, providing care that addressed their injuries while maintaining their ability to perform critical command and communication functions. The situation demonstrated the complex interactions between medical care and military operations. In combat environments where personnel had to fulfill multiple roles despite serious injuries. The 33rd casualty challenged Sarah's physical endurance when Sergeant Robert Kim arrived at her aid station carrying Lance Corporal Maria Gonzalez, who had been wounded while attempting to evacuate another injured Marine from an exposed position under enemy fire. Kim had been struck by shrapnel during the evacuation effort, suffering multiple fragment wounds while successfully carrying Gonzalez to safety despite his own injuries. Gonzalez had suffered a penetrating gunshot wound to her chest that required immediate assessment for lung damage while treating Kim's multiple fragment wounds that had created significant bleeding and tissue damage. Sarah found herself treating 2 Marines simultaneously while both patients remained conscious and concerned about each other's condition, creating an emotional situation that tested her ability to provide reassurance while delivering necessary medical care. Kim's fragment wounds required systematic examination to identify internal injuries, while Gonzalez's chest wound demanded immediate treatment to prevent respiratory compromise that could prove fatal within minutes. Sarah applied pressure dressings to Kim's wounds while performing emergency procedures to address Gonzalez's chest injury, working frantically to stabilize both patients while maintaining awareness of her 31 other casualties. The 34th and 35th casualties arrived as insurgent forces launched what appeared to be a final coordinated assault designed to overrun Marine positions before air support could arrive to break up the attack. Both Marines had been wounded during close-quarters fighting that had brought enemy forces within grenade range of defensive positions, suffering blast injuries from insurgent explosive devices that had been thrown into Marine fighting positions. Private First Class Daniel Washington had suffered severe blast injuries to his abdomen and legs, while Corporal Jennifer Rodriguez had sustained head trauma and multiple fractures from being thrown against a concrete barrier by an explosion. Both Marines required immediate assessment for internal injuries while treating trauma that would challenge the resources of advanced medical facilities operating under optimal conditions. Washington's blast injuries had created internal trauma that required surgical intervention Sarah could not provide, forcing her to develop field-expedient treatment approaches using available equipment and supplies. Rodriguez's head injury required constant neurological monitoring while treating fractures that could indicate additional trauma requiring specialized treatment. The 36th casualty presented unique challenges when Staff Sergeant Lisa Chen arrived at Sarah's aid station with severe burns covering 40% of her body, including her face, hands, and torso. Chen had been injured when an insurgent incendiary device had ignited fuel storage containers near her position, creating a fire that had engulfed her before she could escape to safety. Her burns were immediately life-threatening and would require specialized treatment that exceeded Sarah's capabilities even under ideal conditions. Chen's burn injuries required immediate assessment for respiratory compromise, while providing pain management and wound care using limited supplies that were already depleted by Sarah's overwhelming patient load. The severity of Chen's burns indicated that she would require immediate evacuation to specialized burn treatment facilities, but the tactical situation made evacuation impossible for the foreseeable future. Sarah's treatment approach focused on pain management and respiratory support while developing innovative wound care techniques, using available materials in ways that field medicine manuals had never contemplated. Her emotional investment in Chen's survival motivated creative, Problem-solving that pushed the boundaries of combat medicine while maintaining hope for recovery despite seemingly impossible circumstances. The 37th casualty arrived when Private Michael Thompson was wounded by insurgent sniper fire while attempting to resupply Sarah's aid station with medical supplies that had been desperately needed for hours. Thompson had been struck in the shoulder by a high-velocity rifle round that had created massive tissue damage, while potentially affecting nerve function that could result in permanent disability. Thompson's wound required immediate assessment for vascular and nerve damage while controlling bleeding that could prove serious if not addressed quickly. Sarah conducted detailed examination while applying pressure dressings and establishing intravenous access for pain medication and fluid replacement. Thompson remained conscious and alert, providing valuable information about his condition while helping coordinate resupply efforts despite his injury. The 38th and 39th casualties arrived together when an insurgent mortar round scored a direct hit on a Marine observation post, wounding both sentries with blast injuries. That created complex trauma requiring immediate medical intervention. Lance Corporal Kevin Foster had suffered severe injuries to his legs and abdomen, while Private Amanda Davis had sustained head trauma and multiple fractures that required careful assessment for brain injury and spinal damage. Foster's blast injuries had created internal trauma similar to previous cases Sarah had treated, requiring innovative treatment approaches that pushed her medical skills beyond normal training parameters. Davis's head injury demanded constant monitoring while treating fractures that could indicate additional complications, requiring surgical intervention that was not available under current conditions. Sarah's approach to treating both casualties demonstrated the expertise she had developed during hours of managing complex trauma cases under impossible conditions. Her treatment protocols had evolved through experience and necessity, creating approaches to combat medicine that exceeded standard training while maintaining the highest possible standards of care, given available resources and equipment. The 40th casualty challenged Sarah's emotional resilience when 18-year-old Private Rebecca Martinez arrived at her aid station with injuries similar to those that had affected previous patients, but complicated by the fact that Martinez was the younger sister of one of Sarah's earlier casualties who had died despite her best treatment efforts. Martinez had suffered multiple gunshot wounds while attempting to reach her brother's position, unaware that he had already succumbed to his injuries. Martinez's wounds required immediate treatment while Sarah struggled with the emotional burden of treating someone whose family member she had been unable to save despite exhaustive efforts. The situation tested Sarah's ability to maintain professional composure while providing necessary medical care under circumstances that created additional psychological stress beyond the normal challenges of combat medicine. Sarah's treatment of Martinez demonstrated her ability to compartmentalize emotional responses while maintaining focus on medical priorities that could determine survival prospects for current patients. Her approach emphasized immediate medical needs while providing emotional support that helped Martinez cope with injuries and grief simultaneously. The 41st and 42nd casualties arrived as the engagement entered its 12th hour, with both Marines suffering from exhaustion and minor injuries that had been exacerbated by stress and the physical demands of sustained combat operations. Corporal James Wilson and Private First Class Rachel Johnson had collapsed while attempting to resupply defensive positions, requiring immediate assessment for heat-related injuries and possible underlying medical conditions. Wilson and Johnson's conditions represented medical emergencies that could prove serious without appropriate treatment, demonstrating the cumulative effects of sustained combat operations on Marine personnel who had been fighting continuously for more than half a day. Sarah's treatment focused on fluid replacement and cooling while conducting systematic assessment to rule out more serious underlying conditions that might have contributed to their collapse. The 43rd casualty presented Sarah with her most complex medical challenge when Sergeant Patricia Williams arrived with multiple system trauma that included penetrating wounds to her chest, abdomen, and extremities, along with signs of traumatic brain injury from blast exposure. Williams had been wounded when an insurgent suicide bomber had detonated near her position, creating injuries that would challenge the resources of a fully staffed trauma center operating under optimal conditions. Williams's multiple injuries required simultaneous treatment approaches that tested every aspect of Sarah's medical training while demanding organizational skills that exceeded normal expectations for combat medics. Her chest wounds required immediate assessment for lung damage, while abdominal injuries demanded evaluation for internal organ trauma that could prove fatal without surgical intervention. The complexity of Williams's case required treatment priorities that balanced immediate life-threatening injuries against longer-term complications that could develop during extended treatment periods. Sarah's approach to managing Williams's care demonstrated the expertise she had developed through treating dozens of complex trauma cases under combat conditions. Her treatment protocols incorporated lessons learned from previous patients while adapting techniques to address Williams's specific injury pattern and medical needs. The 44th and 45th casualties arrived together when an insurgent rocket-propelled grenade detonated near a Marine ammunition storage area, creating secondary explosions that wounded both guards with blast injuries and burns that required immediate medical attention. Staff Sergeant Michael Davis had suffered severe burns to his hands and face, along with blast injuries to his torso, while Lance Corporal Jennifer Martinez had sustained multiple fractures and lacerations from flying debris. Davis's burn injuries required specialized treatment that Sarah had learned to provide through treating previous burn cases, while his blast injuries demanded assessment for internal trauma that could prove fatal without surgical intervention. Martinez's fractures required careful immobilization, while treating lacerations that had created significant bleeding and tissue damage. The treatment of both casualties required simultaneous approaches that tested Sarah's ability to manage multiple complex cases while maintaining awareness of her 43 other patients who continued to require active medical intervention and constant monitoring. Her aid station had evolved into a complex medical facility where systematic patient management determined survival prospects for nearly 24 critically injured Marines. The 46th casualty arrived as enemy fire began to slacken, with Private First Class Andrew Thompson suffering from severe psychological trauma that had rendered him unable to function despite the absence of physical injuries. Thompson had witnessed traumatic events during the engagement that had triggered complete emotional breakdown requiring immediate psychological intervention in addition to medical assessment for potential underlying conditions. Thompson's psychological condition required treatment approaches that Sarah had developed while caring for previous patients with similar trauma, emphasizing emotional support and reassurance while creating environments that promoted psychological healing. His case demonstrated the importance of addressing mental health injuries that could prove as debilitating as physical trauma if not treated appropriately. The 47th and final casualty arrived just as the first hints of dawn began to illuminate the eastern horizon, bringing with them the promise of air support and evacuation that had been delayed throughout the night by weather conditions and tactical priorities. Corporal Lisa Rodriguez had been wounded during the final minutes of the engagement, suffering a single gunshot wound to her leg that would normally represent a minor injury but had become complicated by fatigue and stress that affected her body's ability to cope with additional trauma. Rodriguez's wound required immediate treatment while Sarah reflected on the incredible scope of medical care she had provided during 14 hours of sustained combat operations. Her aid station housed 47 wounded Marines whose survival had depended entirely on her medical skills, organizational abilities, and emotional resilience under conditions that had tested every aspect of her training and personal character. The sound of approaching helicopters carried across the valley as dawn broke over positions where Sarah had proven definitively that emotional engagement enhanced rather than compromised medical effectiveness under the most demanding possible conditions. Her colleagues' assumptions about the relationship between compassionate care and clinical competence had been shattered by results that exceeded every standard for combat medical care under impossible circumstances. Sarah had transformed the catastrophic, tactical situation into a medical miracle, saving 47 lives through innovative treatment approaches that had been motivated by emotional investment in patient outcomes. The passionate commitment that had made her colleagues doubt her suitability for combat medicine had proven to be her greatest asset when facing medical challenges that exceeded normal training parameters and equipment capabilities. The approaching evacuation helicopters would carry away living proof that Sarah Chen possessed exactly the qualities necessary for effective combat medicine under the most extreme conditions. Her gentle heart had housed the fierce determination needed to defy death itself, proving that the most effective warriors sometimes came disguised as healers whose compassion masked absolute commitment to preserving human life regardless of the personal cost. The thunder of rotor blades grew louder as 3 U-60 Black Hawk helicopters descended toward the valley floor, their crews already briefed on the unprecedented medical evacuation they were about to witness. Sarah looked up from checking Corporal Rodriguez's bandages, her medical uniform stained with the blood of 47 Marines whose lives hung in the balance of the next critical hours. The morning sun cast long shadows across her makeshift hospital, revealing the organized chaos of what had become the most successful single medic mass casualty operation in modern military history. Major Patricia Anderson, despite her own wounds, had managed to coordinate the evacuation sequence through sheer force of will and radio communications that had never ceased throughout the night. Her voice carried across the aid station as she directed the incoming aircraft toward designated landing zones that Sarah had helped select based on the medical priority of her patients. The evacuation would require multiple trips and careful coordination to ensure that the most critically injured Marines received priority transport to surgical facilities at the main base. Sarah moved between her patients with systematic precision, conducting final assessments that would determine evacuation priorities while ensuring that each Marine was properly prepared for transport that could prove as dangerous as the combat they had survived. Her triage decisions reflected months of experience compressed into a single night, balancing medical priorities against aircraft capacity limitations and the ongoing threat of enemy fire that could compromise evacuation operations. The first helicopter touched down in a whirlwind of dust and debris, its crew chief jumping out with a stretcher team that had been specially configured for mass casualty operations. Flight Medic Staff Sergeant Carlos Rivera approached Sarah's position with the professional respect of someone who had heard radio reports about her performance throughout the night, but was still unprepared for the scope of medical care he encountered. In her aid station, Rivera's initial assessment revealed 47 patients in various stages of treatment, all showing signs of professional medical care that exceeded normal expectations for field treatment under combat conditions. His experienced eye immediately recognized advanced techniques and innovative treatment approaches that demonstrated medical expertise far beyond standard combat medic training. The organization and systematic patient management reflected capabilities that would challenge fully staffed medical facilities operating under optimal conditions. Sarah's handoff briefing for each patient demonstrated the comprehensive understanding she had developed of 47 individual cases during the most demanding night of her medical career. Her verbal reports included detailed injury assessments, treatment provided, medications administered, and ongoing medical needs that would guide continued care during transport and at receiving facilities. The depth of her knowledge about each patient reflected the emotional investment that had motivated her extraordinary performance under impossible circumstances. The evacuation sequence began with the most critically injured patients, including Those with traumatic brain injuries, severe burns, and complex internal trauma that required immediate surgical intervention. Sarah personally supervised the transfer of each patient, ensuring that ongoing medical needs were communicated to flight crews while maintaining treatment that would sustain patients during transport to definitive care facilities. Private first. Class Rebecca Martinez was among the first patients loaded onto the initial helicopter, her multiple gunshot wounds having been stabilized through innovative treatment techniques that had prevented shock and organ failure during hours of sustained medical care. Sarah's final check of Martinez's condition revealed stable vital signs and controlled bleeding that demonstrated the effectiveness of field treatments that had pushed the boundaries of combat medicine. Staff Sergeant Michael Rodriguez followed Martinez onto the aircraft, his blast injury showing signs of healing that exceeded normal expectations for trauma treated under field conditions. Rodriguez remained conscious and alert, expressing gratitude that reflected the emotional connections Sarah had maintained with her patients throughout their treatment. His recovery prospects had been significantly improved by medical care that combined technical excellence with compassionate attention to individual needs. The second helicopter evacuation included patients with severe burns and respiratory injuries, conditions that had challenged Sarah's medical skills while demonstrating the innovative thinking that emotional investment could inspire under extreme circumstances. Sergeant Lisa Chun's burn injuries had been treated using techniques that Sarah had developed during the night, achieving results that exceeded standard protocols through creative applications of available materials and equipment. Chun's condition had stabilized sufficiently to permit evacuation, though she would require extensive treatment at specialized burn facilities. Her survival represented one of Sarah's most significant medical achievements, demonstrating that emotional commitment could motivate the kind of creative problem-solving that saved lives. Under seemingly hopeless circumstances, Chun's burns would heal, but her gratitude towards Sarah would last forever. The third evacuation group consisted of patients with orthopedic injuries and soft tissue trauma that had been systematically treated despite resource limitations that would have challenged traditional medical approaches. Lance Corporal Kevin Washington's spinal injury had been managed using immobilization techniques that protected his spinal cord while maintaining circulation and preventing complications that could have resulted in permanent paralysis. Washington's neurological function had actually improved during his treatment in Sarah's aid station, reflecting medical care that had exceeded optimal protocols through attention to detail and innovative positioning techniques. His recovery prospects included potential return to full function, an outcome that would have seemed impossible during the initial hours after his injury. The final helicopter carried patients with psychological trauma and less severe physical injuries, but every Marine showed signs of the comprehensive medical care that had characterized Sarah's approach throughout the engagement. Even patients with minor injuries had received attention that addressed their immediate medical needs while providing emotional support that contributed to their psychological recovery from combat trauma. Torres emerged from the helicopter as the last patients were being loaded, his weathered face reflecting a fundamental reassessment of assumptions about combat medicine that had shaped his career. His first words to Sarah acknowledged the unprecedented scope of medical care she had provided, while maintaining standards that exceeded anything he had witnessed during 12 years of military medical service. The criticism he had expressed about her emotional sensitivity had been proven completely wrong by results that spoke for themselves. Torres conducted his own assessment of Sarah's aid station, noting the systematic organization and resource management that had enabled effective treatment of 47 casualties using equipment designed for managing perhaps a dozen patients. Under optimal conditions, her innovative approaches to patient care had achieved results that challenged conventional wisdom about the relationship between available resources and treatment outcomes. Every aspect of her medical practice reflected expertise that had been enhanced rather than compromised by emotional engagement with patient care. Walsh and Kim arrived with the final evacuation helicopter, both expressing amazement at the scope of medical care they encountered in Sarah's aid station. Kim's private doubts about Sarah's emotional stability had been completely dispelled by evidence of performance that exceeded every standard for combat medical effectiveness under pressure. His assessment of Sarah's capabilities had been based on training scenarios that bore no resemblance to the reality of sustained combat operations, where emotional resilience proved essential for maintaining high-performance standards. Walsh's experience from 2 previous deployments provided context for evaluating Sarah's achievements, and her professional assessment confirmed that Sarah's performance represented the most effective single medic operation she had ever witnessed. The combination of technical excellence, innovative thinking, and systematic organization reflected capabilities that exceeded normal expectations for combat medics, regardless of their experience level or training background. The final patient evacuation completed Sarah's transformation from a medic whose colleagues had doubted her emotional suitability for combat medicine to a medical professional whose achievements would influence combat medical training and doctrine for years to come. Her approach had demonstrated that emotional engagement enhanced rather than compromised medical effectiveness under the most demanding circumstances, challenging fundamental assumptions about optimal psychological profiles. For combat medical personnel, Major Anderson's after-action report would document Sarah's medical achievements in detail, providing official recognition of performance that had saved 47 lives through medical care that exceeded every standard for field treatment under combat conditions. The report would influence medical training programs and equipment development while establishing new benchmarks for evaluating combat medic effectiveness under extreme stress. Colonel Harrison's review of the engagement would highlight Sarah's performance as a defining example of how individual excellence could influence tactical outcomes under conditions where traditional approaches would have failed. Her medical care had maintained the combat effectiveness of nearly an entire Marine company while preventing casualties that would have significantly degraded unit capabilities during sustained operations. Sarah's equipment, after the engagement, showed signs of the intensive use it had received during 14 hours of continuous medical operations, but every item had been maintained in functional condition through systematic care that reflected her attention to detail under pressure. Her medical kit had been stretched far beyond its designed capabilities, yet had provided the foundation for medical care that achieved results exceeding those typically associated with advanced medical facilities. The intelligence assessment of enemy forces revealed that the Marine Company had faced a coordinated assault by more than 200 insurgent fighters, equipped with advanced weapons and sophisticated tactics. The enemy's failure to achieve their tactical objectives had been influenced significantly by Sarah's medical care, which had maintained Marine combat effectiveness while preventing the casualty rates that insurgent planning had relied upon to achieve success. Sarah's recognition for her performance began with immediate commendation from her chain of command, but would eventually include awards that acknowledged achievements exceeding normal standards for recognition. Her performance had demonstrated individual excellence that influenced tactical outcomes, while establishing new standards for evaluating medical effectiveness under combat conditions. The long-term impact of Sarah's achievements extended beyond individual recognition to influence medical training and doctrine development throughout the military medical community. Her innovative treatment approaches were analyzed and incorporated into training programs that would prepare future combat medics for challenges that exceeded traditional scenarios. Her emotional engagement with patients became a model for balancing professional competence with compassionate care under extreme circumstances. Torres's final evaluation of Sarah included formal acknowledgement that his initial assessment of her capabilities had been completely incorrect, reflecting assumptions about combat medicine that had been challenged by her extraordinary performance. His recommendations for her future assignments emphasized leadership positions where her demonstrated capabilities could influence training and doctrine development for combat medical personnel. Sarah's return to routine duties following the engagement reflected the military's recognition that extraordinary performance should be channeled toward positions where individual excellence could have maximum impact on organizational effectiveness. Her assignment to medical training positions would ensure that future combat medics would benefit from techniques and approaches that had been proven effective under the most demanding possible circumstances. 6 months later, Sarah stood before a class of combat medic trainees at the military's premier medical training facility, sharing lessons learned from an engagement that had redefined understanding of what was possible when technical excellence combined with emotional engagement under extreme stress. Her students listened with the attention that came from knowing they were learning from someone whose achievements had become legendary within the medical community. The training scenarios Sarah developed for her students incorporated elements from her combat experience, creating realistic situations that would prepare future medics for challenges that exceeded traditional training parameters. Her emphasis on emotional engagement as a tool for enhancing medical effectiveness challenged conventional approaches while providing practical techniques that students could apply under actual combat conditions. Sarah's influence on combat medical doctrine extended beyond individual training to encompass equipment development and organizational approaches that reflected lessons learned from managing mass casualties under resource-constrained conditions. Her recommendations influenced procurement decisions and tactical procedures that would benefit military medical operations for decades to come. The combat medics who had questioned Sarah's emotional suitability for their profession eventually became advocates for training approaches that emphasized the benefits of compassionate engagement with patient care. Their transformation reflected broader recognition within the military medical community that emotional intelligence enhanced rather than compromised professional effectiveness under stress. Sarah Chen had proven definitively that a gentle heart could house the fierce determination needed to save lives under the worst possible circumstances. Her achievements had redefined understanding of optimal psychological profiles for combat medical personnel, while demonstrating that the most effective warriors sometimes came disguised as healers, whose compassion motivated extraordinary performance. When lives hung in the balance, the 47 Marines whose lives Sarah had saved would carry forward her legacy through their own continued service and achievements, multiplying the impact of her medical care far beyond the immediate tactical outcomes of a single engagement. Her influence would continue through every life she had touched, every technique she had developed, and every student she would train in the years to come. Sarah had transformed doubt into vindication, criticism into commendation, and skepticism into respect through achievements that spoke louder than any words could convey. The medic they had ignored had become the standard against which all future combat medical performance would be measured, proving that sometimes the most powerful warriors fought their battles not with weapons, but with the healing hands of someone who refused to let death claim what could still be saved. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.